Alex Chen sat in his 2015 Honda Civic outside La Cucina Bella, waiting for the restaurant to finish preparing order number 4827, chicken marsala, Caesar salad, tiramisu, and a bottle of sparkling water. The app on his phone glowed in the dimming evening light. Estimated wait time 4 minutes. Customer location 7.3 miles away in the hills. Estimated delivery time 23 minutes. Payout $18.47 including tip. He'd been doing this for 3 years. 2,847 deliveries. 5-star rating. Top 2% of drivers in the region. It was 6:14 p.m. on a Saturday, which meant the dinner rush was just beginning. Alex would probably do another 8 or 9 deliveries before midnight. If he was efficient, if the app kept pinging him with orders, if traffic wasn't too bad, he might clear $200 for the night, not counting gas and car maintenance. After expenses, maybe $150. 6 nights a week meant roughly $900, about $3,600 per month, about $43,000 per year. He used to make $280,000 per year, before, when he was someone else. Please take a minute to like, comment, and subscribe. We post at least 3 times a week to share tales of true worth. The restaurant door opened and a server emerged carrying a large brown bag. Alex got out of his car, opened the back door, and placed his insulated delivery bag on the seat. The bag was expensive, better than the cheap ones most drivers used, and organized with internal dividers to separate hot items from cold items. Cross-contamination prevention, temperature maintenance, old habits that wouldn't die. "Order for Chen?" the server asked. "That's me." Alex took the bag, felt its weight, checked that everything was sealed properly. The server had stapled the receipt to the bag, standard practice to show it hadn't been tampered with. Alex placed it carefully in his insulated bag, zipped it closed, and put it in the back seat with the bottom strap secured so it wouldn't tip during the drive. "Have a good night," the server said. "You too." Alex got back in his car, entered the customer's address in his GPS, even though he already knew where it was. Mansion in the hills, gated community. He'd delivered there twice before, and pulled out into traffic. The inside of his car was spotlessly clean. No trash. No clutter. No personal items except a small bottle of hand sanitizer in the cup holder, and a package of antibacterial wipes in the center console. The floor mats were vacuumed weekly. The seats were wiped down with disinfectant after every shift. The trunk contained a first aid kit, flares, and a fire extinguisher. His ex-wife used to joke that his car was cleaner than most hospital operating rooms. That had been before the divorce. Before he became an Uber Eats driver. When he'd been Dr. Alexander Chen, attending emergency physician and hospital operating rooms had been something he actually worked in. Alex drove with both hands at 10 and 2, constantly scanning the road. Muscle memory from 15 years of driving to the hospital for emergency calls. He knew where every fire station was, where every urgent care center was located, which routes the ambulances used. His brain tracked these things automatically even though he had no use for the information anymore. At a red light, he flexed his fingers, stretching the tendons, maintaining dexterity. Another old habit. Surgeons did it. Emergency physicians who performed procedures did it. He'd been doing it for so long that his hands moved through the exercises without conscious thought. His phone buzzed. The app. "You're approaching the delivery location. Please follow the instructions provided by the customer." Alex turned onto Ridgewood Drive, passed through the security gate. The guard waved him through, recognized his car, and wound up the hill to 2847 Ridgewood. The house was massive. Glass and steel and money. Probably $8 million, maybe more. He pulled into the circular driveway, grabbed the delivery bag from the back seat, and walked to the front door. The customer instructions said, "Please ring doorbell and leave food at door. Do not knock." Alex rang the doorbell and set the bag down. Took a photo with his phone to confirm delivery. Started walking back to his car. Then he heard screaming from inside. He stopped. His body went rigid. Every instinct from 15 years in the ER fired at once. Female voice. Panicked. Distressed. Emergency. He should get in his car. Mark the delivery as complete. Drive away. None of his business. He was a delivery driver, not a doctor. Not anymore. The screaming continued. Louder now. Please, someone answer. Please. Alex's feet moved toward the door before his brain could tell them not to. He rang the doorbell again. Knocked. Hello? Is everything okay? The door flew open. A woman stood there. Catherine Park, though Alex didn't know her name yet. Maybe 45, wearing expensive casual clothes, phone pressed to her ear, face streaked with tears. Please, help. My husband, he collapsed. I don't know what to do. Behind her, visible through the open door, a man lay on the marble floor of the entryway. 55, maybe. Gray hair, expensive watch, not moving. Catherine was shouting into her phone. Yes, I'm still here. How much longer? An automated voice, tinny through the phone speaker. All 911 operators are currently busy. Your estimated wait time is 9 minutes. Please stay on the line. If this is a life-threatening emergency, 9 minutes. Alex's mind calculated automatically. 9 minutes is forever in a medical emergency. 9 minutes of brain cells dying. 9 minutes of cardiac tissue becoming necrotic. 9 minutes where everything that matters happens. Please, Catherine sobbed, looking at Alex. I don't know what to do. He was fine. And then he said his head hurt, and then Alex's eyes were already scanning the scene with the systematic assessment that had been drilled into him during residency and refined over 15 years of emergency medicine. Patient, male, approximately 55 years old, lying supine on hard surface. Conscious, Alex could see his eyes were open, tracking movement, but something was wrong with his face. The left side drooped, his mouth pulled down on one side. His left arm lay at an odd angle, limp against his body. Face drooping, arm weakness. Sir? The man tried to speak, but the sounds came out wrong. Ka. Speech difficulty. Alex's diagnosis formed in less than 2 seconds. Acute ischemic stroke. Left hemisphere involvement. Classic FAST presentation. He knew what to do, knew the exact protocol, knew that every second mattered, knew that proper intervention now could mean the difference between full recovery and permanent disability. He also knew he wasn't allowed to help, not anymore. He was a delivery driver, nothing more. But his feet were already moving toward the man on the floor. Ma'am, listen to me very carefully, Alex said, his voice shifting into the calm, authoritative tone he'd used for 15 years in the ER. When did your husband's symptoms start? Exactly when? Catherine stared at him, confused. What? Who are you? When did this start? Alex repeated. How long ago? Mabel, 10 minutes? He was sitting at his desk and he called out that his head hurt. And I came in and he tried to stand up and he fell. And 10 minutes. Okay, good. Alex knelt beside the man, his hands automatically moving to check the carotid pulse. Present, rapid, about 110 beats per minute. Elevated but regular rhythm. Sir, can you hear me? If you can hear me, squeeze my right hand. The man's right hand squeezed weakly. His left hand didn't move at all. Good, that's good. Sir, you're going to be okay. I need you to stay calm. Alex looked up at Catherine, who was still holding the phone to her ear, tears streaming down her face, the automated message still draining about wait times. Ma'am, I need you to do exactly what I tell you. Can you do that? Who are you? That doesn't matter. Do you have aspirin in the house? Regular aspirin, not Tylenol or ibuprofen. Aspirin. Yes, in the bathroom upstairs. Get me 1 tablet, regular strength. And tell me, does your husband take any blood thinners, warfarin, Plavix, Eliquis, anything like that? No, just blood pressure medication, I think. What medication? Which one? Lisinopril? I think that's the name. Okay, that's fine, not a blood thinner. Get the aspirin, right now. Catherine ran for the stairs. Alex turned his attention back to the man, David Park, though Alex still didn't know his name. He checked David's airway. Clear. Checked his breathing. Respirations elevated but not labored, about 20 per minute. Checked circulation, pulse present and strong, though fast. Sir, I need you to try something for me. Can you try to smile? Try to show me your teeth. David tried. The right side of his mouth moved, the left side didn't. Classic facial droop. Okay, now raise both arms. Try to hold them up like this. Alex demonstrated. David's right arm lifted shakily. His left arm didn't move. Good. Now, say the sentence. The sky is blue. Can you say that? Sky. Buh. The words were slurred, barely intelligible. FAST positive. Face drooping. Arm weakness. Speech difficulty. Time. Symptom onset 10 minutes ago, which puts us at 15 minutes total by now. Alex knew the statistics by heart. With every minute that passed during a stroke, 1.9 million neurons died. Every 15 minutes, a week of life expectancy was lost. Every hour delayed increased the risk of permanent disability by 30%. Time was everything. Time was life. Catherine came running back down the stairs with a bottle of aspirin. Her hands were shaking so badly she couldn't get the child-proof cap off. Alex took the bottle, opened it in one smooth motion, shook out a single tablet. "Sir, I need you to chew this. Don't swallow it. Chew it. It's going to taste terrible, but chew it thoroughly." He placed the aspirin in David's mouth. David's right side of his jaw worked, chewing weakly. The left side barely moved. "Is 911 still on hold?" Alex asked Catherine. "Yes, it keeps saying." "When they answer, tell them this exactly. I need you to repeat it back to me. Ready?" Catherine nodded, grabbing for a pen and paper from a side table. "Tell them, my husband is having an acute ischemic stroke, left hemisphere involvement, symptom onset approximately." Alex checked his watch. 7:24 p.m. Patient is conscious. Aspirin administered at 7:36 p.m. No contraindications. "Can you say that back to me?" Catherine read from what she'd written. Acute ischemic stroke, left hemisphere involvement, symptom onset 7:24 p.m. Patient conscious, aspirin at 7:36, no contradictions. Contraindications, meaning no reasons not to give aspirin. Contraindications, got it. Alex stayed beside David, monitoring. He checked the pulse again, still elevated but steady. Checked capillary refill in the fingernails, slightly delayed on the left side but present. Checked pupil response, equal and reactive, which was good. No signs of increased intracranial pressure yet. "Sir, I know this is scary, but you're doing great. Help is coming. You just need to hang on." David's right hand reached out, gripped Alex's wrist. His eyes were terrified but conscious, aware, understanding what was happening to him, even if he couldn't speak properly. "You're going to be okay," Alex said, with the practiced certainty he'd learned to project in the ER. Whether he believed it or not didn't matter. What mattered was that the patient believed it. Fear increased blood pressure, increased heart rate, made everything worse. Calm was survival. The automated message on Catherine's phone changed. "You are now first in line. An operator will be with you shortly." "Good," Alex said. "When they answer, tell them exactly what I told you. And one more thing. Your husband needs to go to a certified stroke center, not just any ER. A stroke center specifically. The nearest one is University Medical Center. Tell them that. They need to take him there." Why does that matter? Because stroke centers have neurology specialists and the equipment to administer clot-busting drugs. Regular ERs might not. Time matters. The right hospital matters. How do you know all this? Before Alex could answer, the 911 operator came on the line. 911, what's your emergency? Catherine, reading from her notes. My husband is having an acute ischemic stroke, left hemisphere involvement. Symptom onset 7:24 p.m. Ma'am, can you describe what's happening? He collapsed. His face is drooping. He can't move his left arm. Is he conscious? Yes. Alex gently took the phone from Catherine. I'm a bystander on scene. Patient is a 55-year-old male with acute left-sided facial droop, left arm paralysis, and expressive aphasia. Symptoms started approximately 15 minutes ago. Patient is conscious and alert. Airway is patent. Breathing is adequate. Pulse is present and elevated at about 110 beats per minute. Aspirin was administered 3 minutes ago. Patient needs immediate transport to a certified stroke center. University Medical Center is 18 minutes from this location. Time is critical for thrombolytic therapy. Silence on the other end. Then, sir, are you medical personnel? Alex's chest tightened. EMTs need to bring Al to place if they're able to administer in the field. The patient is well within the 3-hour window for thrombolysis if there are no contraindications on imaging. Every minute of delay increases the risk of permanent disability. Sir, I need to know who you are. Tell them to hurry. Alex handed the phone back to Catherine. The 911 operator was giving Catherine instructions, telling her to keep the patient calm. Not to give him food or water. To unlock the front door for the EMTs. Alex stayed beside David, monitoring. He tilted David's head slightly to the side, airway protection in case of vomiting, which was common with strokes. He checked the pulse again, still elevated. Checked the respiratory rate, still fast but adequate. His mind was calculating automatically. Symptom onset 7:24. Aspirin given 7:36. Current time 7:39. EMT response time in this area averages 8 to 10 minutes. They'll arrive around 7:47. Transport to university 18 minutes puts arrival at 7:65. No, 8:05. That's 41 minutes from symptom onset to stroke center arrival. Still well within the 4.5-hour window for thrombolysis. Good. Sir, stay with me. Keep breathing. You're doing great. David's eyes found Alex's face. His right hand squeezed Alex's wrist again. Not a grip of fear now, but gratitude. Understanding. This stranger kneeling beside him knew what he was doing, knew how to help, was helping. Alex felt the familiar weight settle onto his shoulders, the weight of responsibility, the weight of knowing that this person's life, the quality of their life, whether they'd walk again or talk again or be themselves again, depended on the decisions being made right now, in this moment. It was the weight he'd carried for 15 years, the weight he'd walked away from 3 years ago, the weight he'd sworn he'd never carry again. But here it was, and he couldn't put it down. Not while this man needed help. 6 minutes later, Alex heard sirens approaching. He stood up, went to the door, propped it open so the EMTs could come straight in. 2 paramedics rushed in with equipment, cardiac monitor, oxygen, backboard. The lead medic was Rodriguez, according to his name tag. Maybe 40, experienced, moved with practiced efficiency. Patient upstairs? Rodriguez asked. Right here. Alex gestured to David on the floor. 55-year-old male, acute ischemic stroke, left hemisphere involvement. Symptom onset approximately 21 minutes ago. Patient is conscious, GCS 15, airway patent, breathing adequate at 20 per minute, pulse 110 and regular. Left-sided facial droop, left arm paralysis, expressive aphasia. Aspirin 325 milligrams administered at 7:36. No known contraindications to thrombolysis. Patient takes lisinopril for hypertension. No other medications, no allergies. He needs stroke center transport to University Medical Center. Rodriguez stopped setting up equipment and looked at Alex. Really looked at him. You're a doctor. I'm the Uber Eats driver. Bullshit. You just gave me a better handoff than most ER docs. Rodriguez knelt beside David, began attaching monitor leads. What's your name? Alex Chen. Well, Alex Chen, who's definitely not just a delivery driver, you probably saved this guy's life. Aspirin within 15 minutes of symptom onset. Perfect patient assessment. Stroke center notification. These things matter. The second paramedic was taking vitals, confirming Alex's assessment. Blood pressure 168/94. Pulse 112. Respiratory rate 22. Oxygen saturation 94%. All consistent with acute stroke. Rodriguez pulled out his radio. Dispatch, this is Medic Seddon. We have a stroke alert at 2847 Ridgewood. 55-year-old male. Onset 20 minutes ago. FAST positive. Requesting stroke center notification to University Medical. ETA 20 minutes. They worked quickly, efficiently. IV line established. Oxygen applied. Cardiac monitor showing normal sinus tachycardia. Fast but regular rhythm. Blood glucose check. 118. Normal. They loaded David onto the backboard, then onto the gurney. Rodriguez handed Alex a business card. Listen, I don't know what your story is, but if you're ever interested in EMS work, call me. We need people who actually know what they're doing. I'm not, I can't. Yeah, okay, but the offer stands. Rodriguez and his partner wheeled the gurney toward the ambulance. Catherine followed, grabbing her purse, still crying, trying to call someone on her phone. As they loaded David into the ambulance, Catherine turned back to Alex. Wait, please, who are you? How did you know what to do? Alex was already backing toward his car. His hands were shaking. The adrenaline crash was hitting. His heart was hammering. The familiar post-crisis response that he'd experienced hundreds of times in the ER, but hadn't felt in 3 years. I'm just the delivery driver. Your food's probably cold. I'm sorry. No, please, you saved my husband's life. You knew exactly what to do. The medical terms, the protocols. How did you know all that? Ma'am, I really need to go. Are you a doctor? Alex stopped, turned, looked at her. I used to be. I'm not anymore. Why not? Because I made a choice. The right choice. And I lost everything because of it. His voice was rough, strained. I'm glad I could help your husband. But I really need to leave, now. He got in his car, started the engine, pulled out of the driveway. In his rearview mirror, he could see Catherine standing there, watching him leave, confused and grateful, and probably wondering what the hell just happened. Alex made it 3 blocks before he had to pull over. His hands were shaking so badly he couldn't hold the steering wheel. His chest was tight. His breathing was fast and shallow. He put his head down on the steering wheel and forced himself to breathe slowly. Count to 4, hold. Count to 4, exhale. He'd crossed the line. After 3 years of walking away from every medical emergency he saw, after 3 years of being just a delivery driver and nothing more, he'd crossed the line, used his knowledge, used his training, acted like a doctor, and now Catherine would ask questions, would want to know who he was, would probably Google his name, would find out what happened, would discover that Dr. Alexander Chen wasn't allowed to practice medicine anymore, wasn't allowed to help people anymore, had lost his license for the crime of saving someone's life. His phone buzzed. The Uber Eats app. Delivery completed. Rate your experience. Alex laughed. A sharp, bitter sound. He'd just managed a stroke case better than half the ER residents he'd supervised. And the app wanted him to rate whether the restaurant had his order ready on time. He marked the delivery complete. Started driving home. His shift wasn't over. He should be picking up more orders, should be trying to hit his $200 goal for the night. But he couldn't. Not right now. He needed to go home, needed to be alone, needed to process what had just happened, needed to remember why he'd walked away from medicine in the first place. Alex drove to his apartment on autopilot, parked in his assigned spot, climbed the stairs to the 2nd floor. His apartment was small, 1 bedroom, combination living room kitchen, bathroom with a shower that only had 2 temperature settings, cold and scalding. He'd lived here for 3 years. Rent was $1,800 a month, which consumed almost half his delivery income. The apartment was sparse, bed in one corner, second-hand couch, small TV that he rarely turned on, a desk with his laptop where he tracked his delivery earnings and filed his taxes. No pictures on the walls, no decorations, nothing that made it feel like home. He'd taken down all the photos 2 years ago, after the divorce finalized, after Lisa took everything that mattered and left him with the furniture, and the realization that he'd destroyed his marriage by being too good at a job he wasn't allowed to do anymore. Alex opened his refrigerator. Half a loaf of bread, some deli meat, eggs, orange juice. He wasn't hungry. He made himself eat anyway. Turkey sandwich, glass of juice, because not eating would trigger the anxiety, and he couldn't afford the anxiety right now. His phone rang. Jasmine. He almost didn't answer. Then did. Hey, Alex. You okay? Your location shows you went home early. You sick? Jasmine Rodriguez, 26 years old, restaurant manager at La Cucina Bella, where he picked up half his deliveries. Over the past year, they'd become something like friends. She was smart and ambitious and in night school studying pre-med. She'd noticed things about him that he'd tried to hide. I'm fine, just tired. Liar. What happened? Nothing. Just had a tough delivery. Want to talk about it? Not really. Okay, but I'm here if you change your mind. And Alex, whatever happened, I'm sure you handled it the right way. You always do. After he hung up, Alex sat on his couch in the dark apartment and let the memories come. He'd been fighting them for 3 years, pushing them down, keeping himself busy with deliveries and driving and the simple mechanical work that required no thinking. But tonight, they wouldn't stay buried. County General Hospital. 3 years ago, Friday night, 11:47 p.m. Dr. Alexander Chen was 38 years old and in his 8th year as an attending physician in the emergency department. Friday nights were always busy. Car accidents, assaults, drug overdoses, heart attacks, all the chaos that humanity produced when the sun went down and people's judgment failed them. Alex thrived in it. The chaos didn't bother him. The chaos was where he did his best work. He'd been in the residence lounge, grabbing bad coffee and a stale bagel when his pager went off. Trauma incoming. ETA 4 minutes. Internal injuries, construction accident. Alex went straight to Trauma Bay 1, where the nursing team was already setting up. IV poles, cardiac monitor, intubation equipment, blood products standing by. The choreography of emergency medicine, everyone knowing their role. The EMTs wheeled the patient in. James Martinez, 34 years old, construction worker, crushed by falling equipment at a job site. Conscious but deteriorating. Obvious internal bleeding. Abdomen distended, rigid. Blood pressure 90/60 and dropping. Pulse 120 and thready. Trauma surgeon on the way? Alex asked the charge nurse. Dr. Beaumont. Should be here in 5 minutes. Dr. Richard Beaumont, the on-call general surgeon. Good surgeon when he was sober. Problem was, he wasn't always sober. Alex worked quickly. Large bore IVs in both arms. Fluid resuscitation. Type and cross for 6 units of blood. Focused assessment with sonography for trauma. Fast exam showing free fluid in the abdomen. Blood, lots of it. Where's Beaumont? Alex demanded. Stuck in traffic. Maybe 10 more minutes. 10 minutes Martinez didn't have. His blood pressure was dropping despite the fluids. 85/55 now. His level of consciousness was declining. His skin was pale, cold, clammy. Classic signs of hemorrhagic shock. Get him here now, and prep OR2. We need to get this guy to surgery immediately. The doors to the trauma bay opened. Dr. Beaumont stumbled in, wearing rumpled scrubs, his hair disheveled. And the smell hit Alex immediately. Alcohol, unmistakable. Beaumont was drunk. Sorry, Beaumont mumbled, moving toward the patient. Got here as fast as I could. What do we have? Sir, we need to talk. Outside. Alex grabbed Beaumont's arm, guided him into the hallway. What's wrong? You've been drinking. I had 1 beer with dinner. I can smell it on you. You're impaired. You can't operate. Beaumont's face flushed with anger and shame. I'm fine. I've operated with less sleep than this. Makes me hospital policy. Impaired physician cannot perform surgery. I'm calling the backup surgeon. The backup is 45 minutes away. Your patient doesn't have 45 minutes. Alex knew he was right. Martinez had maybe 10 minutes before he'd arrest from blood loss, maybe less. Then what do you suggest? I suggest you let me operate. You're drunk, and your patient is dying. Pick your poison, Chen. Alex went back into the trauma bay. Martinez's blood pressure was 75/50. His eyes were rolling back. His skin was gray. He's going to die. Right now. He's going to die unless someone operates in the next few minutes. Alex made the decision. The decision that would cost him everything. Prep him for OR, now. Doctor. Chen, who's operating? The charge nurse asked. I am. The room went quiet. Everyone stared at him. You're not a surgeon, the trauma resident said. I did 2 years of surgical residency before I switched to emergency medicine. I can do this procedure. It's a damage control laparotomy. I find the bleeder, I stop the bleeding, I close. It's not complicated. It's against protocol. He'll be dead in 5 minutes if we follow protocol. Get him to OR2. Call anesthesia. Move. Something in his voice made them move. The authority, the certainty, the 15 years of emergency medicine where he'd made life or death decisions and been right far more often than he'd been wrong. They moved Martinez to the OR. Alex scrubbed in. He'd done this before, years ago, during surgical residency. The motions came back. The feel of the instruments. The systematic approach. He opened the abdomen, found the bleeder, a torn branch of the hepatic artery, shredded by the trauma. He clamped it, ligated it, stopped the bleeding, checked for other injuries. Found none that couldn't wait for repair later. He closed. The whole procedure took 42 minutes. Martinez's blood pressure stabilized. Color returned to his face. He was going to live. Alex left the OR, stripped off his gloves, felt the adrenaline crash hitting him. He'd just performed surgery outside his specialty without authorization. He'd saved a life. He'd violated every protocol in the book. The hospital administrator was waiting for him outside the OR. Next to her was the chief of surgery and the chief of emergency medicine. "Dr. Chen, we need to talk." Present day. Alex's apartment, 11:23 p.m. Alex opened his eyes. He'd been sitting in the dark for hours, lost in memory. After that night, everything had unraveled. Martinez lived, made a full recovery, sent Alex a thank you card from his hospital bed. But the medical board didn't care about the outcome. They cared about the rules. Hospital investigation, medical board review, formal hearing. Alex tried to explain, tried to make them understand that he'd made an impossible choice and chosen to save a life. The board's position: protocols exist for patient safety. If we allow physicians to decide which protocols apply to them, we undermine the entire system of medical oversight. Dr. Chen, you performed surgery outside your specialty, without supervision, without authorization. The patient lived, which we acknowledge, but the outcome doesn't justify the violation. So I should have let him die? You should have followed protocol. You should have waited for the backup surgeon. He would have been dead. That's a determination you weren't qualified to make. His license was suspended, then revoked. Appeals denied. 15 years of training and practice, gone, because he'd saved someone's life in the wrong way. His wife Lisa had tried to defend him at first. Alex was right. He saved that man. The board is wrong. But as the months went by, as the legal bills piled up, as Alex sank into depression and couldn't find work, she'd started to see the board's perspective. You could have called the backup surgeon, she'd said one night. Martinez would have died. You don't know that. Maybe they would have gotten there in time. His blood pressure was 75/50. He was in hemorrhagic shock. He had minutes. But you decided. You made that call without consulting anyone, without following the rules. And maybe the rules are there for a reason, Alex. Maybe they're there to prevent doctors from playing God. I didn't play God. I stopped someone from dying. And now you can't practice medicine. Now you can't help anyone. Was it worth it? He hadn't known how to answer that. Still didn't. The divorce papers came 6 months later. Lisa remarried a year after that. Another pediatrician, someone who followed the rules and came home at reasonable hours and didn't make impossible choices that destroyed careers. Alex took the first job he could get that didn't require a medical license. Uber Eats driver. It paid minimum wage plus tips. It required no credentials, no background check beyond a driving record, no responsibility beyond delivering food from point A to point B. It was the opposite of emergency medicine, and that had been exactly what he needed. Until tonight, until he'd crossed the line again, until he'd helped someone again, until he'd remembered what it felt like to use his knowledge and training to save a life. And now Catherine Park would ask questions, would want to know who he was, would probably try to thank him, maybe even try to help him get his license back. But Alex didn't want his license back, didn't want to practice medicine again, didn't want to carry the weight of people's lives, didn't want to work 80-hour weeks and make impossible decisions and come home exhausted and empty. He wanted to deliver food. He wanted to drive around the city. He wanted to go to bed at night without dreaming about patients dying. He wanted to be invisible, to be nobody, to be the delivery driver and nothing more. But tonight had proven something he'd been trying to deny for 3 years. He couldn't turn it off, couldn't stop being a doctor, even when he wasn't allowed to be one anymore. And he didn't know what to do about that. Alex didn't work the next day, Sunday. He stayed in his apartment, ate cereal for breakfast, and leftover pizza for dinner, tried to watch TV and couldn't focus. His mind kept replaying the stroke case, kept analyzing his interventions, kept wondering if David Park had made it to the stroke center in time, if they'd administered thrombolytics, if he'd survived, if there was permanent damage. Monday morning, he forced himself back to work. Logged into the Uber Eats app at 10 a.m., started accepting orders. The routine was comforting. Pick up food, deliver food, repeat. No thinking required. At 2 p.m., he was at La Cucina Bella picking up an order when Jasmine cornered him. Okay, spill. What happened Saturday night? Nothing. Alex, you've been off for 2 days and you look like you haven't slept. What happened? He told her. Not everything, but the basics. the stroke case, the emergency intervention, the fact that he'd used medical knowledge he wasn't supposed to have anymore. Jasmine stared at him. "You're a doctor?" "Was a doctor, not anymore." "What happened?" "I saved someone's life by breaking the rules, and I lost my license for it." "That's insane." "That's medicine. Rules matter, protocols matter. You can't just decide which ones apply to you. Even if someone dies?" "According to the medical board, yes." Jasmine was quiet for a long moment. Then, "Alex, do you miss it, being a doctor?" "No." "Liar." "I don't miss the pressure. Don't miss the liability. Don't miss the 80-hour weeks. But you miss helping people." Alex didn't answer. Couldn't answer, because she was right. That night, as he was doing his evening deliveries, his phone rang. Unknown number. He almost didn't answer, then did. "Hello? Is this Alex Chen?" A woman's voice. Cultured, educated. "Yes. This is Catherine Park. You saved my husband on Saturday night." Alex's chest tightened. "How did you get my number?" "The Uber Eats app. I requested you as my driver for a delivery. I'm at the restaurant right now. Will you please come inside? I need to talk to you." "Mrs. Park, please. 5 minutes." Alex looked at the address. La Cucina Bella. She'd specifically requested him, had tracked him down. He could refuse, could decline the delivery, could block her number. But he needed to know. Needed to know if David Park had survived. "I'll be there in 10 minutes. Catherine Park was waiting inside the restaurant's lobby. She stood when Alex entered, extended her hand. He shook it automatically. "Thank you for coming," she said. "Can we sit? I promise I won't take much of your time." They sat at a table near the window. Catherine looked different than she had on Saturday night. Composed now, makeup perfect, expensive clothes. But her eyes were red-rimmed, like she'd been crying recently. "How is he?" Alex asked. "Your husband. He's going to make a full recovery. The doctors at University Medical said he was incredibly lucky. They administered the thrombolytics within the window. The clot broke up. He has some minor weakness on his left side still, some slight speech difficulty, but they expect 95% recovery within 3 months." Alex felt something loosen in his chest. "That's good. I'm glad. They told me that if he'd arrived even 10 minutes later, the outcome would have been very different. Permanent paralysis, severe speech impairment, maybe death." Her voice broke. "You saved his life. I just followed basic stroke protocols." "Stop." Catherine's voice was firm. "Stop pretending you're just a delivery driver. I looked you up, Dr. Chen. I know who you are, what you were, what happened to you." Alex's jaw clenched. Of course she had. Of course. "Then you know I'm not a doctor anymore. You lost your license for performing emergency surgery when the on-call surgeon arrived drunk. I violated protocol. You saved a man's life, and the medical board punished you for it." Catherine leaned forward. "My husband is David Park, CEO of Tech Health Solutions. We develop healthcare technology, electronic medical records, diagnostic AI, telemedicine platforms. We have resources, connections. We can help you get your license back." "No. Dr. Chen, it's just Alex, and no, I don't want my license back." Catherine stared at him. "You're serious?" "Yes." "Why?" "Because I don't want to practice medicine anymore. I don't want to work 80-hour weeks. I don't want to make life or death decisions. I don't want to carry the weight of people's lives on my shoulders." "But you just saved my husband." "Because I had to. Because no one else was there. Because I couldn't watch someone die when I knew how to help. But that doesn't mean I want to go back to being a doctor." "I don't understand." Alex took a breath. "Mrs. Park, do you know what it's like to have someone's life in your hands? To know that if you make the wrong call, if you miss a symptom, if you order the wrong test, if you give the wrong medication, they die. And you carry that every day, every shift, every patient, for years, for decades, and it consumes you. It takes everything you have. It destroys your marriage, your relationships, your health. It takes everything. And then you make one choice, the right choice, the choice that saves a life, and you lose everything anyway." His voice was raw now. "So no, Mrs. Park. I don't want my license back. I don't want to be Dr. Chen again. I don't want to go back to that life. I want to deliver food and go home and sleep at night without dreaming about patients dying." Catherine was quiet for a long time. Then, "I understand. I do. But Dr. Chen, Alex, there has to be a middle ground between being an ER doctor and delivering food." "Like what?" "I don't know yet, but will you at least think about it?" Let me think about it. We owe you David's life. Let us try to help you. Mrs. Park, please, just think about it. Alex stood up. I need to get back to work. I'm glad your husband is okay. He left before she could say anything else, got in his car, started the engine. His hands were shaking again. There has to be a middle ground. Maybe there was, maybe there wasn't. But Alex had been living in the safest ground he could find for 3 years, and he didn't know if he could risk leaving it. 2 weeks passed. Alex tried to go back to normal, delivering food, keeping his head down, staying invisible. But Catherine Park's words kept echoing in his mind. There has to be a middle ground. And then one Tuesday, as he was picking up an order from La Cucina Bella, Jasmine approached with a strange expression. Alex, there's someone here to see you. She says she has a proposition. Catherine Park sat at a table near the back, 2 coffee cups in front of her. She smiled when she saw Alex and gestured to the seat across from her. I ordered you coffee. Black, 2 sugars. Jasmine told me that's how you drink it. Alex sat down reluctantly. Mrs. Park, Catherine, please. She pushed one of the cups toward him. I have been thinking about what you said, about not wanting to practice medicine, about wanting a simpler life. And I think I have an idea, a compromise. I'm listening. You can't practice medicine. Fine, but you can teach. You can train people in emergency response, FAST protocol for strokes, CPR, basic first aid, how to recognize medical emergencies and what to do until help arrives. There are classes for that, taught by people who've never seen a real emergency. You have 15 years of ER experience. You know what actually saves lives, not the textbook version, the real-world version. I'm not a teacher. You taught me perfect stroke protocol in 2 minutes, under extreme stress, and I remembered every word. You're a natural teacher. Catherine leaned forward. Here's my idea. Tech Health will fund a training program for gig workers, Uber drivers, Lyft drivers, delivery drivers. We're everywhere in the city. We see emergencies constantly. What if we knew what to do? You want me to teach gig workers emergency response? Weekly classes, small groups, basic protocols that anyone can learn. How to recognize a stroke and call 911 properly. How to do CPR. How to stop bleeding. How to help someone who's choking. Things that don't require a medical license, but can save lives. Alex thought about it. What's the pay? $50 an hour, 2-hour classes, twice a week. That's $200 a week, on top of your delivery income. $200 a week was significant, would bring his income up from $3,600 a month to $4,400. Would mean he could actually save money instead of barely breaking even. But more than that, the idea appealed to him. Teaching people how to help, how to recognize emergencies, how to keep someone alive until paramedics arrived. That wasn't practicing medicine. That was education. If I teach people wrong, if someone gets hurt because of something I taught them, you'll teach them to call 911 and keep people alive until help arrives. That's it. No diagnoses, no treatment. Just how to not let someone die while waiting for paramedics. There's no liability in that, and we'll have a lawyer review all the materials to make sure. Alex picked up the coffee, sipped it. It was good coffee, better than anything he made at home. I'll try it, he said finally. 1 class. If it goes badly, I stop. Catherine smiled. Deal. The first class was held 2 weeks later in a community center conference room. 15 people showed up. Uber drivers, delivery drivers, rideshare drivers, mostly young people, mostly immigrants or students working their way through college. People who needed flexible work and couldn't afford traditional jobs with health insurance and benefits. Alex stood in front of them, feeling terrified. He hadn't taught anything in years, hadn't stood in front of a group and tried to convey knowledge since his days supervising residents in the ER. My name is Alex Chen. I used to work in emergency medicine. Now I drive for Uber Eats. I'm going to teach you some basic emergency response protocols that might save someone's life. He started with a question. How many of you have been to a scene where someone needed medical help? All 15 hands went up. How many of you knew what to do? 2 hands stayed up. That's what we're here to change. I can't teach you to be paramedics. I can't teach you to diagnose or treat medical conditions. but I can teach you to recognize common emergencies and keep people alive until help arrives. And sometimes, often, that's the difference between life and death. He taught them FAST for strokes: face drooping, arm weakness, speech difficulty, time to call 911. If you see these signs, you call 911 and you say, "I think this person is having a stroke." You don't diagnose it. You just report what you see. The 911 operator will ask questions. You answer them. You keep the person calm. You note the time the symptoms started. That's critical for treatment. And you make sure they go to a stroke center, not just any hospital. He taught them CPR basics: chest compressions, hand placement, the rhythm, 100 to 120 compressions per minute, about 2 inches deep. He made them practice on mannequins until they got it right. You're not trying to restart their heart. You're trying to keep blood flowing to their brain until paramedics arrive with a defibrillator. Quality compressions matter more than perfect technique. Someone doing imperfect CPR has a way better chance of survival than someone getting no CPR at all. He taught them how to recognize choking, how to perform the Heimlich maneuver, how to position someone who was unconscious to protect their airway. He taught them how to control bleeding, direct pressure, elevation, pressure points as a last resort if direct pressure failed. He taught them how to recognize anaphylaxis, the severe allergic reaction that could kill in minutes, and how to help someone use their own EpiPen if they had one. You're not administering medication. You're helping them self-administer. Big difference. If someone says, "I'm having an allergic reaction, I need my EpiPen," you can help them use it. That's not practicing medicine. That's following their instruction. 2 hours passed in what felt like 20 minutes. When the class ended, the students surrounded him with questions. "I saw someone having a seizure last month. What should I have done? My passenger started having chest pain. Was that a heart attack? Someone in my car was diabetic and seemed confused. What was that?" Alex answered them all, gave them clear, simple protocols. Call 911, report symptoms, keep the person safe, wait for help. As they were leaving, a young woman approached him. "Mr. Chen, thank you. My grandmother had a stroke 2 years ago. Nobody knew what to do. By the time the ambulance came, it was too late. She's in a nursing home now. Can't talk, can't walk. If someone had known FAST protocol." Her voice broke. Alex felt his chest tighten. "I'm sorry about your grandmother. That's why I came today. So if I ever see it happen again, I'll know what to do." After everyone left, Catherine appeared in the doorway. "How did it feel?" "Terrifying, but good. They loved you." Half of them already signed up for next week's class. Next week? Word is spreading. I have 43 people signed up for the next session. I think we need to split it into 2 classes. Alex sat down in one of the folding chairs. 43 people. People who wanted to learn, who wanted to help, who wanted to be ready when emergencies happened. "Okay," he said, 2 classes, but I'm still delivering food. That's not changing." "Fair enough." 6 months after the stroke case, Alex was teaching 4 classes a week, 2 beginner sessions and 2 advanced sessions. He was making an extra $800 a week on top of his delivery income. More importantly, he was making a difference. A delivery driver used his training to save a choking victim at a restaurant, called Alex afterward to thank him. A rideshare driver recognized the signs of sepsis in an elderly passenger: fever, confusion, rapid heart rate, and insisted on taking them to the ER instead of their home address. Saved their life. An Uber driver performed CPR on a passenger who had a cardiac arrest in the back seat, kept them alive until paramedics arrived. The passenger survived. Each story reached Alex somehow, through the gig worker network, through Catherine, through students who came back to class to share. Each one made him feel something he hadn't felt in 3 years: purpose. Jasmine got accepted to medical school. She brought Alex a bottle of wine to celebrate. "I wouldn't have pursued medicine if I hadn't met you," she told him. "Seeing what you know, what you can do, what you lost and still kept going, it inspired me. You're going to be a great doctor. Will you write me a recommendation letter?" "I'm not a doctor." "No, but you're the person who taught me that medicine isn't just about credentials. It's about helping people." And you're helping hundreds of people, thousands maybe, indirectly through the people they'll help. Alex wrote the letter. It felt strange, signing it Alex Chen, delivery driver and emergency response instructor, instead of Dr. Alexander Chen, emergency medicine. But it also felt right. 1 year after the stroke case, David and Catherine Park invited Alex to their home for dinner. A thank you dinner, Catherine called it, though Alex suspected it was more than that. David looked healthy. His speech was back to normal. His gait was normal. His left arm had full strength. He was one of the lucky ones, caught early enough, treated properly, recovered fully. Alex, we want to expand your program, David said over dinner. Take it national. Partner with Uber, Lyft, DoorDash, all the gig platforms. Make emergency response training mandatory for all drivers. That's massive. We'll fund the curriculum development. We'll hire instructors and train them using your methods. We'll create video courses for areas where in-person training isn't feasible. We'll certify everyone who completes the training. And we want you to lead it, Catherine added. Director of Emergency Education. You'd develop the curriculum, train the trainers, oversee quality control. Salary would be commensurate with the position, probably around $120,000 to start. Alex set down his fork. $120,000, plus his delivery income if he kept doing it. That was almost what he'd made as an ER doctor, but without the liability, without the life-or-death decisions, without the 80-hour weeks. That's a lot of responsibility. Not life-or-death responsibility, David said. Teaching responsibility, administrative responsibility, making sure people learn the right protocols. But you wouldn't be treating patients. You wouldn't be making medical decisions. You'd be educating civilians on how to help until professionals arrive. What if people get hurt because of something I taught? You're teaching them to call 911 and perform basic first aid. Courts have consistently held that Good Samaritan laws protect people who try to help in emergencies. And you're not teaching people to practice medicine. You're teaching them to recognize emergencies and take appropriate action until help arrives. There's no liability in that. Alex thought about it. Thought about the hundreds of people he'd already trained. Thought about the lives that had been saved because delivery drivers knew FAST protocol, because rideshare drivers knew CPR, because gig workers knew how to recognize emergencies. Thought about the exponential impact. If he trained trainers who trained thousands of drivers, who each encountered dozens of emergencies over their careers. Can I think about it? Of course. 2 years after the stroke case, Alex stood in front of 200 gig workers in a hotel conference center, teaching the largest class he'd ever taught. They'd come from all over the region, delivery drivers, rideshare drivers, couriers, all of them wanting to learn how to save lives. The most important thing isn't perfect technique, Alex said, demonstrating CPR on a mannequin. It's willingness to try. Someone doing imperfect CPR has a better chance of survival than someone getting no CPR at all. You're not doctors, you're not paramedics, but you're there, you're present when emergencies happen, and if you know what to do, you can keep people alive until the professionals arrive, and that makes all the difference. After the class, a young driver approached him. Mr. Chen, I used your training last week. Guy in my car started having chest pain. I pulled over, called 911, kept him calm, gave him aspirin just like you taught. EMTs said I probably saved his life. Alex felt the familiar tightness in his chest, the good kind. You did that, not me. You taught me. You had the courage to act. That night, lying in bed in his apartment that was still sparse, but felt more like home now, Alex thought about the journey he'd taken. From ER attending physician earning $280,000 a year and working 80-hour weeks and carrying the weight of life or death decisions, to delivery driver earning $43,000 and working flexible hours and carrying only the weight of insulated food bags, to whatever he was now. Director of Emergency Education for Tech Health Solutions, earning $120,000 plus benefits, still delivering food 3 nights a week because he liked the simplicity, liked the routine, liked not having to think. Teaching 2,000 gig workers per month through in-person classes and video courses. Training trainers in 12 cities across the country. His phone buzzed. Text from Jasmine, who was finishing her first year of medical school. Used your FAST protocol in my clinical rotation today. Recognized a stroke in a patient the residents were about to send home. Attending said I saved the patient's life. Thank you for teaching me to look. Alex smiled. Texted back, you did that. I just taught you what to look for. His ex-wife Lisa had reached out 6 months ago. She'd heard about his program, about what he was building, wanted to congratulate him, said she was proud of him. Said she was sorry for not understanding earlier why he'd done what he did. They'd met for coffee, talked for 2 hours. Not about getting back together, that ship had sailed, but about forgiveness, about understanding, about the fact that sometimes there are no good choices, only impossible ones, and you have to live with the consequences either way. You found your middle ground, she'd said. I'm glad. Alex hadn't known he'd been looking for a middle ground. Thought he'd been hiding, running, escaping from the person he used to be. But maybe she was right. Maybe this was middle ground. Using his knowledge without the burden of direct patient care. Teaching instead of treating. Saving lives by proxy instead of with his own hands. He picked up his phone and scrolled through his photo album. He'd started taking pictures again. Nothing profound. Just deliveries, classes, students practicing CPR, certification ceremonies. Building a new archive, a new life documented. There was a photo from last week, a delivery driver holding up her emergency response certification, grinning. Below it, a news article she'd sent him. Delivery driver saves choking victim using training from local program. That driver was one of 2,000. 2,000 drivers, each working 6 days a week. Each encountering an emergency every few months. The math was staggering. Hundreds of lives saved every year, maybe thousands over time, all because he'd taught people to recognize emergencies and take action. Impact at scale. The exponential power of education. Dr. Alexander Chen had treated maybe 5,000 patients a year when he worked in the ER, saved hundreds of lives directly with his own skills. Alex Chen, the educator, was indirectly saving more lives than that, by teaching others, by creating a network of trained civilians who were there when emergencies happened, before paramedics arrived, during the critical minutes when intervention mattered most. It wasn't the career he'd planned, wasn't the life he'd imagined when he'd started medical school 20 years ago. But it was good work, important work, work that mattered, and he could sleep at night now. Could close his eyes without seeing the patients who died despite his best efforts, could wake up without the crushing weight of responsibility that had followed him for 15 years. He was still a doctor, in a way, still using his knowledge to save lives, just differently. Just in a way that didn't destroy him in the process. Alex set his phone aside and turned off the light. Tomorrow he'd teach 2 classes, one in the morning, one in the evening. In between, he'd deliver food for 4 hours, because he still liked the work, still liked the simplicity, still needed the reminder that not everything had to be life or death. He'd pick up orders from La Cucina Bella, where Jasmine would probably give him coffee and ask about his weekend. He'd drive through the city he'd learned to know by heart. He'd deliver food to people who had no idea he'd once been a doctor, who saw him as just another gig worker trying to make rent. And that was okay. Better than okay. It was exactly what he needed. He'd lost everything 3 years ago. His license, his career, his marriage, his identity. But he'd built something new from the pieces. Something different. Something sustainable. He wasn't Dr. Alexander Chen anymore. ER attending physician, brilliant diagnostician, the man who could save lives but couldn't save himself. He was just Alex. The delivery driver who taught people how to help, the educator who created a network of civilian first responders, the man who found a way to use his gifts without being destroyed by them. And some days, most days, that was enough. More than enough. It was everything. Please take a minute to like, comment, and subscribe. We post at least 3 times a week to share tales of true worth.